Hi there, Dr. Malka. Today I'm going to be speaking to you about eye strain and how you can relieve eye strain through massage. Now keep in mind you may want to go to your eye doctor if you have a lot of pressure. It could be something else. But when people spend a lot of time in front of the computer or reading a lot, studying, or they're playing sports where they need to focus their eyes, or perhaps mountain biking where a lot of wind is blowing on the eye, you can start getting pressure and pain around in the eyeball area and even maybe twitching. I had a patient come in who was really a little bit desperate because he had this really odd involuntary twitching in his eye, and he was worried that his coworkers were thinking he was winking at them. So this is the picture of the eye muscles that attach around the eyeball and help your eye to move. Right here is your nose, so this would be your right eye. And so you have a muscle right here on the medial aspect, the lateral aspect. These will turn your eye from side to side. You have the ones above, ones below. That'll bring your eye up and down. And then you have oblique muscles that'll bring your eye down to your nose. So if you want to be cross-eyed and look at your nose, or up and out. And all these muscles then working together can help rotate the eyeball. And this is the muscle that can control squinting and the eyelid in general, and is responsible for eye twitching. In case you decide to go to an acupuncturist to treat this condition, I want you to know what to expect. So the acupuncturist will be putting needles around this last eye muscle that I pointed out. And as you can see, these needles are very thin. They're a ½ inch long, and the thinness is about the same as 3 hairs. And this muscle, as I just pointed out, is responsible for squinting and eyelid movement. And these needles are really completely painless. Physical therapists call this dry needling, but it's really just acupuncture. And in acupuncture, these are considered local points or ashi points. It's my dog in the background. You could just ignore him. Someone's at the door. I bring him to the office with me. Maybe the mailman coming in and delivering mail. I'm going to be resting here for 10 to 20 minutes, just allowing the needles to relax the muscles. I've been resting here for 20 minutes. I feel really nice and relaxed, as you should, and now we're ready to take them out. And as you can see, these needles are very fine. A little bit of bleeding there. That's normal. Not very common. Yeah, maybe 1 out of every 10 will have a little blood that comes, but there won't be any bruising from that. When you're massaging the eye, you'll want to utilize a Q-tip. And I just outlined several of the muscles on the graph, so keep that in mind as I'm going through this procedure. So to massage the muscle on the top, you'll want to look down. To massage the lower muscle, you'll want to look up. To massage the outer muscle, you'll want to look in. The inner muscle, you'll want to look out. This way you're exposing the muscle. So let's start with the muscle on top. I'm going to look down and put the Q-tip here and just do really slight back and forth rubbing. And then look up, and again, back and forth rubbing with the Q-tip. And make a mental note which muscles you're working on can be a little painful, because that's probably the muscle that's the culprit, and you'll want to go back and massage that one more. Turn your eye to the left, massage this outer muscle here, that lateral or outside muscle. Turn your eye to the outside, working this inner muscle. Now these next ones could be a little bit difficult because they're the muscles that are your oblique muscle. So you have an oblique muscle up here. You're going to want to look down past your nose in an oblique direction, putting the Q-tip here and rubbing back and forth. And now that one I can actually feel a little bit. I probably have a little eye strain there. And then look down and over to the right. And then bring the Q-tip up. And this one's a little sore for me too. Just back and forth, maybe 1/4 of an inch. You could almost not even see it. And then look up and out, massaging this lower muscle here. Then up and looking in, doing the opposite side. Continue to repeat as needed, looking down to massage the upper muscle, up for the lower muscle, to the side for the outer muscle, the inner muscle, and then the oblique. Again, looking in the opposite direction of where you're going to be massaging. Now we're going to continue with the other eye, and you always want to throw away the Q-tip that you're using just in case you may have an infection starting here. You don't want to do a cross infection. So then a nice fresh Q-tip again for the other eye in case your left eye is the one that's involved. Looking down and massaging this muscle. The muscle is right at the midpoint of the eyeball. Oh, this one's a little sensitive for me. Then looking up, massaging this lower muscle. And it should be a pretty firm pressure. And then looking out, get the inner eye muscle. And then look to the other side and press. And the pressure you should be doing should maybe be as if a couple silver dollars are pressing on the Q-tip. Now we're going to do the obliques, looking down past the nose in an oblique. And then you're not going to be doing it down here, but up here. Again, the opposite of where you're looking. Down and to this side. up oblique, up in the other direction, and again repeating, down for the upper muscle, up for the lower muscle, looking to the outside for that inner muscle, looking towards the other direction for that outer muscle, as well as the obliques. Down and out to massage the up and inner muscle, down and in to massage the outer muscle, up and in, and then up and out. When I treat patients for the twitching eye or eye strain, it's really usually a one-hit wonder. So you can really work on your eye and get really pretty immediate results. And then when you're finished massaging the muscle, just get an ice pack or a bag of frozen peas and just put it on the eyes and close your eyes and relax for about 10 minutes. To massage the secondary muscles of the eyes, I really like to do shiatsu points. So you can start in the middle of the eye here, just press, and you'll feel the orbital bone, just pressing down on the orbital bone. There's 4 pressure points, and then you have the pressure point on the outside of the orbital bone, and then continuing up. Do this with your fingers or with your thumbs, just along this orbital bone, just drop off. And then this is one that you see very common, just putting some pressure in here. And then continue on. Repeat this 3 or 4 times. And this will also release that sinus type pressure. That's really not sinus pressure. It's just being mimicked by the tight muscles around the sinus region. And pressing, you may want to spend a little more time, maybe about 10 seconds, pressing on this area. Now you're finished with your eye massage. Review for self-treatment of eye strain or eye twitching. Take the opportunity now to take your cell phone out and take a screenshot so you have the information with you. Number 1, use a Q-tip to gently massage the eye muscles. The pressure should be equal to the weight of a couple silver dollars, and movement back and forth should be about 6 millimeters or 1/4 inch. Move the eye in the opposite direction from the muscle being massaged. For example, to massage the muscle on the top of the eye, look down. Massage each muscle for 10 seconds and repeat until you get relief. Number 2, ice the eye with an ice pack for 20 minutes every hour for several hours. We will be launching a new YouTube video every Friday at 3 p.m. and I will be available for any questions you have or suggestions for future videos. To allow me to make more videos for you in the future, please press the subscribe button, press the notification button so you don't miss a video, and press the like button, and be sure to share with your friends and family.